Assalamualaikum. My name is Faryal, and the purpose of this video is to know that how to work in a dental lab. Actually, some time ago, couple of incidents were occurred in the lab, so I decided to make a lecture for newcomers and students regarding the SOPs and the protocols which are needed to be followed while working in a lab in order to prevent any mishap. This lecture has been divided into three categories. First one is the working style basics and how to sit, how to work. Second part is about the safety, and the third one is about the infection control. Without discussing much, let's jump to the lecture. Welcome back. As we all know that most of us already know that what to do in a dental lab, like the process of fabrication of prostheses, how the denture is made or an appliance is made. But now we are going to talk about how to do it. What the care should be taken while working in a lab so that we may keep ourselves safe and secure from any mishap. So this presentation is about that orientation. As we have already discussed that this presentation has been divided into three categories. First one, the blue one or the purple one, is the working style. Second one is about the safety, and third one is about the infection control. So talking about the working style, it is further divided into the basic, height, size of the table, sitting positions and working positions. Basics. There are a couple of things which are needed to be considered. Size of the working table, and in the size we are not talking about the height. It will be discussed in the next slide. We are going to talk about the depth and width. It is dependent upon the work, load of the work, and about the size on which you are comfortable. You are going to select that size, the depth and the width of the table. But mostly 24 inches to 48 inches is sufficient for work, but you can extend it according to your need. Height of the working station, it will be discussed in detail. After that, equipment installed. We have got plenty of equipment which is installed over the table, like micromotor burner and electric knife. Ideal light angle. The light which is installed over the workstation, it should be approximately at the 30 degrees. So from the eye level, it should be installed at this level, so that while you are working, no shadow of your hands to be placed over the working table, and if it is installed beyond that, shadow will be made, and if it is installed below that, light will be, your eyes will be affected with the light. And the working stool. So going further into these details, the height of the table. So different heights of the table is dependent upon the task that you are going to perform. If you are going to install the table in a plaster room or plaster lab, then most of the work is going to be done while standing position, so height will be different. But as most of the job is done while you are sitting, so in a normal average heighted person in our region, in subcontinent, the average height is considered 5 feet 6 inches. So for 5'6" heighted person, the height of working table should be approximately 32 to 34 inches. It will be comfortable for most of the task. And your viewing angle is approximately 20 degrees. Like that, if you have a straight head, you need to bend the head slightly downward, and your angle would be 20 degrees, while viewing range is approximately 10 to 40 degrees. Sitting position, yes, one of the important things for optimal working. As this is our profession and we are going to do this work for lifelong, so we have a better switching position so that for long working hours our posture will be defining our work, and it will making us more comfortable. So for optimal working, person should be seated deeply and comfortably, that you should have your back in contact with the backrest of the stool, and foot should be adjusted as comfortable as leg position, and I mostly say that there must be approximately a 90-degree angle from the back and the thighs, and from the thighs to legs and to the feet. So the angle should be approximately near the 90 degrees, and your body should be approximately 10-inch away from the working table, so that if it is more than that, you have to lean towards your table and your position will be compromised, and if you are more close to them, then your body will be touching to the working station, and it can cause many problems regarding to the infection control and other stuff. So a slight difference from 8 to 10 inches is quite comfortable one. Your wrist should be slightly supported from the edge of the table, and stool should be without armrest, because if there are armrests present, it will restrict your arm movements. So stools are recommended to be without arms, and adjustable stool is always ideal so that you can adjust the height according to your comfortable position. So these are some working positions, mostly are for right-handed people. This one is the working position one. You are going to have a hand rest like that. This one is slightly, as we have talked that approximately 20 degrees, your head is inclined forward like 20 degrees. So this is another comfortable position. And this is the third one, where you are going to have a support from the edge of the table. These are a couple of working position. Main thing is that you need to have a better posture for better working. Now coming to the second part of the presentation, that is about the safety. It has some basic safety rules that we should be keeping in our mind, and there are different types of equipment which is going to be handled by any professional, some kind of rotary equipment, high temperature equipment, and we need to have some safety protocol with the chemicals that are going to be used. So safety rule number one, you need to follow the manufacturer instruction, the instruction manual. Why? First thing, that instruction manual has the details about how to use any equipment. Secondly, it has some safety instructions, and third one, if something happening, something which is not according to the schedule, and you need to have some troubleshooting, so it has the details about that troubleshooting details. Second, never operate a machine without any training, because there are a couple of reasons. First one, it can harm you if it is not being used in a proper manner, then you can get yourself injured with the use. And secondly, most of the equipment is extremely expensive related to dentistry, so you need to take care of the instruments and equipment too. Safety rule number 3, it is always better to have a partner. The partner is always welcomed, because it is always two are better than one. You can have better ideas, you can have suggestions while working, and a slight chit chat makes the working easy and pleasing, and you can have the support in case of any emergency. We have seen most of the tasks are done in pairs, so it is better to have a partner. Safety rule number 4, that you need to wear closed toe shoes. Open-ended shoes, open-toe shoes are not recommended. Closed toe shoes are always welcomed because you need to protect yourself from the falling objects, sharp objects which can roll down, slide down to your shoes. In this case, you can see that this black shoe is quite comfortable and recommended in this whole scenario, and this one too. These open-ended shoes are not recommended, and I have seen many students which come to the lab with what you can washroom slippers. I don't feel comfortable, and I don't suggest that you are using Crocs or washroom slippers. That is not a professional, shoes to be used in a lab. Safety rule number 5, you need to avoid yourself by wearing loose jewelry, loose hair, long sleeves, long nails. And one of the student was having all this stuff, so I decided to take a picture of her. You can see that she has long nails, jewelry. Loose jewelry means the bracelet, long bracelet which are hanging or strapping. It is like the long sleeves. It acts like a long sleeve. Loose hair, and the problem with these stuff that it will keep entangling with the instrument, with the tools which are present on the table, and such long nails will tear the gloves. And same thing with the sharp jewelry, sharp jewelry in your ring or kind of that. It can tear up the glove, and it is not recommended. And the long hair should be properly tightened, and use the hair cap for this purpose, head cap for this purpose, to secure yourself. Safety rule number 6, you need to wear some basic protective gear. Eyewear, which is needed to avoid from the splashes. Face mask, we have seen the importance of face mask in this corona pandemic. You need to use the gloves, yes, to secure yourself, to secure your hands while dealing in the different materials and equipment. And you need to use the overall, any gown, overcoat, overall, what kind of protective gear you feel comfortable with. And I used to call the overcoat overall as the glove of a body. And the same thing is safety rule number 7 is that you need to secure yourself from the sharp objects like wires, knives, blades, cutters. So it is always recommended to put your tools in such a way that they should face away from your body instead towards yourself. Now, safety from the rotary equipment, we use the micromotor. Most of the micromotor are to be used on high speed, and most of the high speed, the minimum speed in most of the micromotor is 35,000 rotations per minute. It means that the instrument which is attached, the burr, the bit which is attached on the handpiece of the micromotor, it moves at the top speed. If you are using it at the 35 RPM, 35,000 RPM, so it moves 35,000 times in a minute. So when any instrument moving at this high speed can be dangerous if not dealt with care. So you need to avoid yourself while using the micromotor or high speed. You should try to avoid the gloves, try to avoid long nails. Again, hygiene and nail are among the first those things which are compromised and which are trimmed away with the buzz. You need to avoid using the vibrating bars. It is very dangerous to use those bars. Actually, when the bar is vibrating and if you use it at the high speed, it just can bend to any direction and it can hurt your fingers and hands. And you need to use the cradle or the stand, handy stand, which are provided with the motor, or you can hang it like that, place it over this cradle. The thing is that the handpiece is in round form and it mostly moves and falls from the table, rotates from the table, so you need to use that handpiece stand for that purpose. Again, coming to the model trimmer, it also moves at high speed. I think 4,000 to 8,000 rotations per minute. Since the circumference of this stone is large, so it can be very dangerous. So long sleeve, long nails are contraindicated while using the rotary, while using the model trimmer. Now coming to the high-speed lathes, different types of buffs are attached to the high-speed lathes, polishing lathes. So you need to avoid the long sleeves, long nails, and your polishing lathe should not be vibrating. Now, high temperature, we use the preheat furnace or casting machine. So you need to use the protective gear like forceps and the care, protective gear, the care should be taken, because at the temperature of like preheat furnace, it can be raised till 11,000 to 1100 to 1200 centigrade, 1200 centigrade. So it can be problematic if not dealt with the care. And the Bunsen burner, this is the main item of every dental lab, so you need to use the protective gear and care should be taken while dealing with the high temperature equipment. Safety with the chemicals, there are couple of materials which are flammable, which are toxic, and acrylic resin is among the basic materials which are used in the lab, and I have seen many professionals to do this mistake, that they keep the highly flammable material near the Bunsen burner, and I have seen couple of incidents which are happened. So I have made a video just to let you know that how dangerous it is to have the acrylic resin near the burner. Let me play the video like that. This video is also available on the YouTube. I will share the link. And in this video, actually sound is a bit muffled up, so sorry for that. I'm going to explain along with the video that what we are going to do, what we are going to experience here. So here what we are going to do, that we are going to take a pinch of acrylic heat cure powder, methyl methacrylate, and we are going to pour it over the burner. And let's see what kind of how does it behave around the burning flame. Again, care should be taken. This is just for information purpose. Do not try to use it. It is always better to take the precautionary measure while experience such thing. So what we are going to do, that we are going to take a pinch of powder and we are going to throw it over the flame and see how it behaves. Yes, it is that flammable. See, it just catches the fire so quick that it can be fatal, it can be dangerous. Now what we are going to do, that we are going to take a swab of the liquid, and we are going to wave over the swab without liquid, and let's see, does it catches the fire? No, it doesn't. And we are going to add a couple of drops over it, and we are going to wave it over the flame, and let's see how it behaves. file just catches up and it doesn't go off soon. So what you need to know that you need to keep whether it's a powder or a liquid away from the flame. You need to be extremely careful about that. Now, talking about the infection control, it has been divided into two parts: sources and the precautions, which are needed to be taken care of. First one is the source. There is the direct route of transmission. It could be if you came directly in contact with the blood or the saliva of the patient, it could be avoided by say taking care of while washing and using the protective gear. And second is the indirect route of transmission or accidental exposures, which can be done with the tools, the knife, carvers, cutter blade, the working station where you are working and on which the task is being done. So what are the precautions which should be taken? First one is the preparing for the work. Before the work means that there should be different tables assigned, different workstation, different work areas assigned for incoming work and outgoing work. And secondly, the environment should be well ventilated. It should be airy. Now, before work, you need to use the protective gear. You need to clean your workstation before and after the task is done, and you need to disinfect the models and environment where needed. Models, there are different types of disinfectants available for models and benches and processes. You can use those kind of disinfectant, and for other for the area, for the environment, you can use the surface disinfectant to clean your workstation. Now after work, you need to clean your workstation before and after, and you need to disinfect your processes, your cases. And how we do it? I use the ultrasonic cleaner for that purpose, and I have put some couple of disinfectant, model disinfectant and the surface disinfectant, along with some detergent, and it is and I recommend that it should be used for that purpose. Now there are some must do's. You need to wash your hands before and after, and this corona has told us that what is the parameters of washing the hands. Before that, some of companies were telling that 10-second hand wash is enough, but I think we all know that 20 to 30-second minimum hand wash is required for proper hand wash. You need to, second thing is that you need to wash your impression, and it should be done under the running water, or you can use the chemical agents, again surface disinfectant or model disinfectants or some impression disinfectant. And running water is required. The logic behind that, the water should be pouring from one end and it should move and go directly to the drain from moving throughout the impression material. And next thing is that you need to use the zip pouches, that your models or processes or impression should be in zip pouch, and it should be properly sealed, so that external and internal should remain in its place. Infection should not be spreaded, and you need to use the fire and safety protocol if in any case needed. And there are some must do nots that we should be taking care of. There should be no eating and drinking in the work area, and you need to avoid your personal belongings like bags, and you need to avoid that. And the reason behind that, if I use my bag in that working area, and if I put it on that, it will work as a carrier, and when I put that bag into my cupboard or in my other area, that infection will be transferred using my bag. So you need to avoid that. Try to avoid running in the lab, because many materials are spilled over the floor, so you need to avoid that, and you need to avoid the loose hair, sleeve, or jewelry. That should be taken care of. You need to avoid that. You need to use a waste disposal wisely. There are different codings in our region. We use two color coding. Yellow is for infectious waste, and white or blue for non-infectious waste.
So where does this leave us? It's a piece of advice, and it tells the whole story of this infection control area. That, believe me, once a wise man said that, believe me, if you're not keeping it clean, you're doing it all wrong. Actually, it is said by me. So here are a couple of books that were needed. First one is Lab Manuals of Dentistry, and it has been written by me. It covers all the lab procedures which are performed in any dental lab related to the college, and there are some other safety guidelines and other stuff from where I have taken this all material. So in case you want to ask any question, you want to comment, or you want to discuss anything, you want to guide me about anything, you can contact me via these channels.
So if you see that there's something that they are trying to prove here. Is the thing that guy, that doctor, supposedly this person is a doctor, he's coming from the clinic and he's wearing a coat. In that they are trying to prove this guy as, portrait this guy as a doctor or some professional. And as I told you that the overall is works kind of glove of the body, and you are wearing your clinical gloves, your clinical barrier, your cloth barrier, your body barrier to your home. Since mother has cleaned all the household items with some detergent and some disinfectants and other stuff, while this guy comes from the clinic wearing that infectious coat, and it brings that infections along with his coat to his home, and he meets his son, and this is what he is trying to spread the infection at home, while her mother is trying to teach that how to keep yourself clean. Wow. So this kills 10 types, different kinds of the germs, and story doesn't end here. Is the thing that he has removed his tie while he is keep on wearing his coat in home at dinner table, trying to prove this guy, trying to portray this guy a doctor, while something different is happening here. Why I'm showing this? The main reason of showing this to you, that this is what happens when you hire some non-professional person to do a professional job. They think that some nice lady with nice outfit and some nice guy with nice outfit will let them to explain the importance of the life boy. Instead of, they are trying to tell that looks can be deceiving, you know that it's important to use your head instead of your always try to better to have some professional instead of non-professional. Same thing, there are a couple of pictures that I need to show you. Let me. So what is happening here? They are claiming that they are India's leading diagnostic company, and the problem here is that she is holding the X-ray radiograph upside down. What they have that a nice good looking lady will do the job, but the story is a bit different here. So it is better to have some professional to do a professional job, not some non-professional to do a professional job. This picture has been taken by me. Ufone is a leading telecom company here in Pakistan, and I don't know what kind of hole they are trying to sell. Again, you hire a non-professional to do a professional job. Education is really very important. And again, since I have criticized the Liveboy, it is my job to appreciate the efforts that they have put this in this pandemic. What they are doing, this is advert that they have shown us. They have promoted and suggested the users to use, if LiPo is not available, people can use Dettol Safeguard or Lux just to keep themselves clean. And this kind of the profession which is needed, and I would really appreciate them for putting such kind of offer. Highly appreciated. So this was the end of presentation. You have any kind of question or query or suggestion, you can ask that question, or you can contact me on my WhatsApp or this on the end of this video. This whole presentation is available on the SlideShare. You want to consult, you can have it from there. And thank you very much. Assalamu alaikum.